Hello there, fellow classmates. My name is Marcia Destin, and I'm majoring in nursing. Today, I'm going to talk to you guys about the persistence effect of cervical cancer can have on the female's body and the female's ovaries, and what HPV honestly plays its role within cervical cancer. Now, to begin with, a lot of people are like, well, what does one have to do with the other? Well, without HPV, cervical cancer cannot have been what it is today. HPV is one of the most dangerous types of infections one can have. And HPV has been around for decades, but it's just the simple fact of a lot of people do not know about HPV for the simple fact of not a lot of females get annual pap smears as they should as soon as they hit the age of 21. Now, according to one of the sources that I cited, what is HPV? It states that this is one of the most common transmitted sexual STIs that are out there today in women. And it also states that it has 150 related viruses inside of it, and it is contacted by skin-to-skin contact and intimacy. Now, I know a lot of young people nowadays are actually intimate, but how intimate can you guys honestly be, knowing the simple fact of condoms don't really stop HPV from spreading because the areas around the HPV can honestly spread. Now, let's take it back. HPV is basically a wart. It's like a little bubble that comes up on you, and it's like, you would think like it's like a pus, but it's really not. It's definitely a wart. And according to another source that I cited, which is HPV human papillomavirus, states that about 50% of people will honestly have HPV in their lifetime without even knowing. And it's scary because we as females should always protect ourselves, but get this, males are the ones that carry HPV. They are the main trait of HPV, and females, we're the ones that actually carry it out and then have cervical cancer. Now, a lot of people ask, what is cervical cancer? Cervical cancer is a trait that is in the lining cells of the cervix. It's in the lower part of the uterus, which is the womb, and this is sometimes called the uterine cervix. The fetus grows in the body of the uterus, which is the upper part, and the cervix connects to the body of the uterus, to the vagina towards the birth canal. The part of the cervix closest to the body of the uterus is called the endocervix. Now, this is where magic happens, shall I say, for the simple fact of this is where cervical cancer takes its trait and what it does for most females. Now, according to one of the other sources that I cited, what are the key statistics about cervical cancer? It states that about 4,120 women will die from cervical cancer each year. That is a big amount of number. And the only people that honestly have cervical cancer are Hispanic women, blacks, white, Pacific Islanders, and Asians. That's absurd to know that any and every female can carry cervical cancer from the trait of HPV, which is given to us by a male. And also from one of the sources that I cited, it stated that 8 things you should know about cervical cancer is that some of the symptoms don't go unnoticed and it doesn't happen. But some people that do have the symptoms have abnormal vaginal bleeding, an unusual discharge, and pain during sexual intercourse. Now, if you have any 3 of these, then you should honestly consult with your doctor. And when I say discharge, some of the discharge may have blood within it. And the other source that I cited, 10 things you didn't know about below the belt cancer, also states that only 68% of cervical cancer patients can live longer than 5 years. 5 years to most of us is honestly basically like a lifetime. But to cervical cancer patients or any cancer patient, 5 years is like 3 days to them, and they're honestly living by a thread. So please, 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 please. I know now in today's society, a lot of people do not want to practice abstinence or whatever the case may be. However, cervical cancer is out there. It's not a new virus. It's a very much of an old virus that a lot of people need to know. Please, females, get tested once a year. I'm sorry. It's not like STD or anything like that. It's an STI, and you're supposed to have a pap smear test just to even make sure that you're okay with this. Now, please, ladies, be safe out there. Wrap it up. Whatever you need to do. Again, my name's Marsha, and I hope you like it. Here's my note card. Have a good one.